marks the start of National Infertility Awareness Week, and joining us now is Dr. Mary Casey Jacob from the Center for Advanced Reproductive Services at UConn Health Center. Thank you so much for being here.
My pleasure.
So when we talk about a week to talk about awareness, do you find that a lot of people still, not only are they still struggling, but the people around them, the family and friends, don't know what to say?
I think that's absolutely true. I think people struggle with deciding themselves that they might be having fertility problems, but once they do, family and friends, they don't know what to say, but they don't know what to say. So a common source of stress for our patients is family and friends trying to be helpful, but actually being intrusive and not helpful.
What's an example of what not to say?
Just relax, it'll happen.
Okay.
Adopt and you'll get pregnant. You're trying too hard.
Okay. And instead, what could you say that would be more comforting if someone in your family is going through this struggle?
I think you have to ask the people in your family how to respond. What comforts you is not necessarily going to be what comforts me.
Yeah.
And so when we have somebody in our family life who's struggling with anything, including infertility, we have to say, what can I do that would be helpful to you? Mm-hmm. Do you want me to ask? Do you want me not to ask?
Right. And just it's a normal question. The minute you get married, the next question is, when are you having babies? When are you having babies? And you would say, as a psychologist who's helping people through the infertility process, that that's probably not the best thing to do, because you never know if someone's struggling.
It's very intrusive. It's funny how the topic of pregnancy is treated like public property in our worlds. We don't say, so how much money do you make? Or all kinds of other questions we don't ask, but we do ask, when are you going to have a baby?
Yeah, and then we touch people. Okay.
We do. We rub their tummies, even if we don't know who they are.
Now, I was there to do the amazing work they're doing with the technology, and the IVF is really helping families that would, maybe 30 years ago they could have never had babies.
That's right.
But what you do is you mitigate the stress, because stress, we know, is a factor, right? Whether or not someone's going to actually conceive, even with all the medical technology.
Actually, that is a common misconception.
Really?
There is not good evidence that stress is a causal factor for infertility.
Okay.
Even though there's loads of stuff being published to suggest that's the case, but the research is terrible. I always kid with our patients and say, if we thought stress was a causal factor, you'd all be required to see me before you go and see the physician, because then we'd really be good at what we do.
Yeah.
Stress is a result of infertility. It's a result of feeling incompetent, like your body's letting you down, that you're sad all the time, that it seems like everybody's pregnant but you. So stress is a huge variable in people's lives when they have infertility. But as far as we know, it does not cause the difficulty.
The good thing is when you go to the UConn Health Center, they're not just going to treat the physical issues of having a baby. You can go to a psychologist such as yourself, and you're going to help people through the process. How will you help couples get through it?
Sometimes I help them figure out how to cope with all the sadness or even the anger that they feel. Sometimes I help them cope with their differences in coping, because commonly within couples, whether you're heterosexual or not, commonly the two people don't cope the same way, so I help them. I help people get over things like needle phobias if they need to do injections, or quit smoking, because that's a big fertility factor. I help them decide when to stop and to look at another way of making a family, or to accept that perhaps they're not going to have children. So it's all kinds of help, but the goal is to help people move forward in their lives with no regret.
Okay, and so all of these services are available to you. We'll have the link on our website. The Center for Advanced Reproductive Services, I know, often has outreach to the community. That you can go for a free session, learn more about it, and nice to know that they've got the physical and the mental covered for you.
I've been there 23 years, so it's always been a part of our program.
Dr. Mary Casey Jacob, thank you so much for being with us. And you can find out more information by going to our website. Scott?
All right, thanks, Karen.